Good afternoon, friends. I am Dr. Nidhi Shivkumar, psychiatrist at Aster Clinics. Today is World Mental Health Day, 10th October 2024. Let us first try to know what is a mental health. Mental health is a state of mental well-being in which a human being is able to cope up with the stresses of the daily life, to realize his or her ability to learn new things and work well and contribute to the communities. In short, anybody who can live, laugh, and love is healthy mentally. World Mental Health Day, there is an objective for this day today is mental health at workplace. What is my role? What is your role? Let us understand. Mental Health Day was founded in 1948 by the Federation of Mental Health. Today, more than 100 countries are involved in this. The motto is awareness of the mental health to realize that mental health is as important as physical health, and then opportunity to raise the awareness of mental health, educate people about the well-being of the mental health. And last but not least, reduce the discrimination towards the patient of mental illness. Coming to the objective this year, WHO has decided to keep the objective mental health at workplace. Friends, you will be astonished to know that about 45% of the workers, they feel a term called as Sunday anxiety, Sunday night anxiety. That is a that shows that how stressed a worker is. World mental health, the importance of the world mental health in the workplace can never be overlooked, because mental health challenges such as stress, anxiety, and burnout has significantly impacted the employees' performance, job satisfaction. Now, coming to in terms of the overall impact of the workplace is an estimated of about $1 trillion of globally money is lost because of stress at workplace. Depression and anxiety contribute to a major chunk of it. Globally, there are about a loss of 12 billion working days. Yes, my dear friends, 12 billion working days are lost, and $1 trillion of money goes waste just because of the stress or poor work environment. 30% of it is caused because of either depression or because of anxiety. What can we do as employers? Things to be done at employers level is we must encourage a good awareness among the people we are working with about our mental health, access to counseling services, implementing flexible work hours as per the individual's requirement, and encourage work and life balance. There are about myths of mental illnesses. People say we should not talk of mental illness in the workplace, but on the contrary, being open about mental health helps in destigmatizing the topic and have a better support to these people who are suffering from the illness. Second myth is with the mental health is a sign of weakness, or in other words, you are saying that a mental illness patient is a weak patient. No, mental illnesses are the result of biological, hormonal, environmental causes which overall presents to the individual as a mental illness. Third myth is mental illness issues make a bad employee, which is not, because with treatment, the person can be as productive as a normal individual and produce quality work for the organization. The World Mental Health Day 2024, the organizations must prioritize this day in order to reduce what is called abstinence and lower the turnout rates and increase the employee engagement among with each other. How do we do a mental health discussion? So, mental health discussion at work is a must. It's also a business necessity in the long run, because there are two new words which I came across in the internet. One is presentism and one is absenteeism because of the stress. Presentism means the person is present at work, but he or she is not productive. And absenteeism is he's not present at all. Both are a result of poor mental health, and which has negative impacts on a person in terms of his cognitive approach, his behavioral pattern, his emotional changes, his social and rational well-being. And ultimately, a person loses his identity and well-being to be related to the work. In simple words, we can have understand this as a cascade of events, one after other. A person is stressed, he or she reduces his productivity at work, which produces more stress and causes stress, anxiety, and depression, leading to some individuals into indulgence in alcohol, drugs, or other substances, causing further escalation of the stress and reduced productivity. So it is a cascade of events which needs to be addressed. Presentism, as I already described you, absenteeism, I already described you. These two terms heavily impact the productivity of any organization or company. Now, how are we going to prevent the mental illness at work? What to do? What can we do? Prevention is, we can include yoga, meditation, exercises in our daily schedule. Awareness of mental health is most important. We must watch our thoughts, watch our mood, watch our sleep-wake cycle all across the day. Mental health and performance and promotion should be done at a workplace. Soft skills must be taught to the managers, how to speak, how to have a gender sensitization, and socializing activities among the colleagues. These all are preventive measures. Now, prevention is very important at another level, wherein there are some people who are in very much risk of going into a mental illness, from mental distress to a mental illness. And what are those individuals who are vulnerable? First, those who are undergoing a difficult marriage, those who are having a disabled parent at home, who are stressed because of either family burden or chronic medical conditions like diabetes, blood pressure, cancer, disabled parents at home, and people with high risk jobs like health professionals, police people, army or organization personals. So we must include our counseling services as a part of the team in any organization. Secondly, periodic screening should be done for employees. Accommodation of flexible timings as per the person's requirement, if possible administratively, should be inculcated. Work from home is another way out, for especially for ladies or for females who have to look after both home as well as the house as well as the office. Liberal leave whenever needed should be provided. Health insurance as well as financial support from the company can also reduce stress at workplace. Then coming to the mental world, or what organization can do with a person who has already developed a mental illness. First of all, support the person who is suffering from a mental disorder, improve the drug compliance, avoid discrimination at workplace, which is very common when once a person gets the illness. Must involve the family members with the treatment. Change a high risk or a high stress workplace to a low stress workplace, shift the person to a desk job if he or she is finding it difficult. And organizational interventions also includes, after the right of service with the disability, now organizations should recruit individuals with a mental illness, because this will help recruiting the person into the organization and helps in his rehabilitation. So that is also one way of reducing the illness. Finally, to summarize my talk, I would like to stress upon the ROI, the return of investment in the mental health is very, very fruitful. Mental health should not be left alone only to the medical professionals or psychiatrists. It is a duty of every citizen to look after each other's mental state at workplace as well as at home, and every organization need to have some policy of mental health at workplace. Promoting mental health at workplace, you have to train your managers to pick up early signs of stress in an individual. What are early signs of stress? Palpitation, lack of sleep, change in the sleep pattern, chronic headaches, chronic abdominal discomforts. These are some signs of a chronic stress. Try to connect face to face with your colleagues, with your subordinates. Promote work and life balance. Socialize if possible outside workplace also, intermittently. Offer mental health perks. Encourage physical activities during the workday, even during the working hours. Now, coming to a term called work-life balance, I have been saying it again and again. Now, it is a very, very difficult thing to achieve. It's very easy to say, but it is a harmony between professional and personal life. I would like to tell you, guys, you are replaceable at your workplace, but you are not replaceable in your family, among your friends. So set boundaries, establish your work hours, set time limit to work. Don't take your work home. Once you are at home, you should be a father, a child, a husband, or a brother. Prioritize. Even I would like to say, learn to say no. Friends, this is a quality to say no. It takes some courage sometimes to say no in favor of your own health. Engage in your hobbies. I'm sure we all are having hidden talents. We all are having some or the other hobbies. Inculcate your hobbies in your life, and that will reduce the overall stress. Involve time with your loved ones. Involve time with your parents. Reduce your screen time and seek support. Whenever you feel your family member or yourself needs some support, please approach to a psychiatrist or a mental health worker. Don't delay, because the more you delay, the more time it takes to recover from a mental illness. So seeking therapy is not a weakness. Seeking mental therapy is actually, you see, is an act of courage. Now, to conclude, I would like to say thanks to all of you for attending this short talk. I'm ready to take any questions from the audience.
Okay, so doctor, there's one question asked over here. How can I help someone who is struggling through a mental health?
Yeah, what can we do for a person who is struggling with a mental health? Definitely, first of all, support him, don't leave him or her alone. Encourage the person to seek mental health from a psychiatrist or from a clinical psychologist who can evaluate whether the person is having simple anxiety or a depression, underlying depression. Because many mental illnesses sometimes present as as acidity, headaches, lack of sleep, sexual issues, and husband and wife marital conflicts. So you must refer the patient to the psychiatrist. That's what I can say.
Okay, sir. So the second question is over here. What are the immediate tips for stress relief?
Immediate tips for the stress relief? Well, take a time out. I must say it's a good question. What you can do, you can take a break every 30 minutes of your screen time or your office time, stroll around. You can listen to some music, you can talk to your friends, your family members for a while, and that's it. That's a short term, but this is all short term.
Okay, sir. Thank you. The third question over here we have is, does yoga or meditation help in reducing stress?
Yoga and meditation definitely reduces stress. In fact, yoga produces some good chemicals in the brain like serotonin, and meditation at the same time reduces stress, and they are actually a part of treatment in many of the mental illnesses like depression, severe anxiety, PTSD. So they are the part of treatment. Yes.
Okay, thanks, sir. So the one last question over here is, does people around affect our mental health?
Come again, please.
Does people around over here affect our mental health?
Yes, that's what I said. The people around you, if you see, it's an energy which transfers from one to another. If you are disturbed, you will make others disturb only. That's what I taught in my small talk. If is a difficult boss, for example, can produce a negative health environment around him or her, so it's very, very correct that yes, people around you. So the best way to do is distance yourself from negative energy or people who are you find difficult to work with. I know, I accept it is difficult. Many a times you can't avoid it.
So over here, there's one more question. How to tackle anxiety?
Well, what is an anxiety that you should understand? Anxiety is you are living in tomorrow, you are worrying about tomorrow. First of all, think that it's start to live in today. If the anxiety is too much and it's involving your sleep, your health issues, you must speak to a psychiatrist, you must consult a psychiatrist, and there are very simple treatment in the early stages of anxiety. However, if anxiety goes for months together, it gets converted into a mood disorder, most likely depression. So, and yes, anxiety should be addressed.
Okay, sir. Another question over here is, how can companies help promote mental health examples, include psychiatrist treatment as a part of a mental insurance?
Yeah, unfortunately, I'm finding in my own experience that a lot of insurance companies are not covering mental health and psychiatric illnesses. The companies, first of all, should have regular counselings, regular screenings, must teach their managers and the bosses to pick up early signs of mental illness. I would say there is no harm in having a short course of awareness of mental health to the executives. I would love to do that. The insurance companies, I would like to address, they must include psychiatric illnesses because it is on the rise. The stress is on the rise in the society.
Okay, sir. So there is another question. Are there any tests to assess stress?
Well, there are some questionnaires which are available on the internet, on the social medias, but I would like to address good screening test is perceived stress questionnaire or Beck's depressive inventory for anxiety, stress, and depression. These are simple questionnaires which are available. However, you must watch your own health in terms of sleep, mood, irritability, interpersonal relationships, If they are disturbed, definitely you are not in a sound mental health.
So here there's one of the audience asking which Aster you are working in.
Uh, well, I'm working at Muteena Aster Clinic, a part of DMPC.
Over here, another question is, so the teens who got issues, how to help them? Is it related to mental health illness?
I couldn't understand.
The teens who got issues,
Okay.
how to help them? Is it related to the mental
Yeah,
illness?
it's a very good question. Teens, I'm seeing a lot of teenagers presenting with mood disorders, depression, severe anxiety, and drug abuse. And another thing, attention deficit hyperactivity disorder. What teens are today experiencing is their awareness is getting distracted to multiple places. We are training our mind to handle many things together, especially in social media, with the internet world. Teens who are suffering with some kind of stress, they generally have poor school or academic decline. They have, if they have if they have a irritability, if they have sleep disturbances, you must consult a psychiatrist. Teenage mental disorders are on the rise, and I myself have treated a lot of patients in the teenage group. This is a serious issue. School authorities must employ counselors and clinical psychologists. They can filter out many such cases and refer them to psychiatrists.
So another question over here is, are there any diet recommendations for improving health, mental health?
Well, good question. This again, diet plays an important role in our not only physical but mental health also. Diets which is say rich in fiber, green leafy vegetables, uh, uh, exact balance of protein, carbohydrates as well as fibers, vitamins should be taken. Avoid alcohol. Avoid all aerated soda drinks, caffeinated drinks, high protein rich supplements should be avoided because a large number of cases of kidney injuries and nephrotoxicity has been seen in these. You should have diet at correct time, right? Like don't delay your dinner, don't skip your breakfast. These are important meals of the day.
Okay. So the another question over here we have is, why are the Gen Z teenagers facing more mental issues? This mental issue weren't there to our elders. What changed the generation idea? Generation teens.
The new generation or Generation Z is unfortunately the victims of stress from many angles. You see, when we were teenagers, there was no computer, there was hardly a telephone, a phone. Nowadays, a person who is a teenager gets indulged in internet excessively. That's called a term internet addiction. You see, we are noticing, we are coming across patients of internet addiction which needs proper treatment. Then there is something called social media bullying, which is again disturbing the teenagers. Likes or dislikes on an internet affects the emotional health of a child. Besides the tough competition which in the academics which we are witnessing, there are very tough competition in the academic field which we were not when we were child. And another angle is a nuclear family. The concept of nuclear and subnuclear family is now coming up. In yesteryears, when there was a concept of joint family, the stress was much less in the teenagers. But now there are both parents are working, less time is given to the child. And in the joint family concept, that the stress was definitely less. So these are the differences in the previous era and Generation Z era.
Thank you so much for answering all the questions. I think that's about it for the Q&A.
Thank you very much. Thank you very much for listening. Thank you very much.